Hi, Doc.
Okay, I'm gonna go ahead and start the webinar. Everyone looks amazing.
And you probably have questions today too for us too, Caesar.
Let me check with Luke. He has access. I don't see any questions, but I'll pose it onto the chat.
And also the closed caption. Hi, Marciano. Are you across the walkway?
Yes, I'm in my office. And my apologies, I was talking to Ricky on the phone.
Okay, we are recording. I'm gonna send another email just to the campus. We're having folks trickle in. There's about 4 attendees right now.
Hi, Erin. Nice to see you. Hello, Miss Dottie. You look beautiful.
Have we started or can I? Leslie, we'd love to get you connected to Jamie soon, okay?
Yes, please.
One second here. Good morning, everybody. Thank you for joining our Campus Ready session Q&A. We're just going to need a few more minutes for folks to come in. If you have any questions, again, please add those to the chat. We'll get them to our panelists shortly and try to answer any questions or concerns you may have with our reopening, returning to campus. And again, we have these sessions recorded and they're also available on our YouTube channel.
So Caesar, did you want us to go ahead and get started with a couple things?
You know what? Yeah, let's get started, please.
Yeah. Maybe just like, I just have a couple things. Hi, everyone. Tilly Chavez, Vice President Instruction here at City College. Thank you for joining us today at our Campus Ready session. I can't even say which number it is because it's here every week and will continue to be here every week until we don't seem to have any questions about returning back on and reopening on campus. We have some special guests today, but before we get to all of them, I just want to do a little recap on a couple of things, if that's okay, Caesar, with you. I wanted to send out a big shout out to our own John Parker. He's going to be surprised. He's like, what did I do? Well, John, I have to tell you, ladies' room, paper towels, and quality paper. Thank you.
Wow.
For the men's room too. Yeah. So, I mean, that's a big shout out.
Yeah, it's the 2-ply.
Wow. Thank you. It's wonderful to see. And I mean, I bring that up because things do happen. They just take a little bit of time, right? Things are happening along the way. And as they do, I think it's important that we take that little recognition and say, thank you very much. It makes a big difference for us. So, and the restrooms have been opened like they're supposed to be. So we have hiccups along the way, but if we don't know that there are issues, we can't fix them. We can't try to help them. So that's just one small example on that. And that was also that came up in our dean's meeting this week, that actually with paper towels, John, from somewhere else on campus. So that's why I wanted to be able and share that with you.
Good
Yeah,
job.
see, lots of fingers are, hey, everybody's yes, thank you for that.
I'll pass it on to Jay and his team.
Thank you to Jay and them. They're doing quite a bit, and trying to keep up with us can be a tough act. So I just wanted to put that out there. And Caesar, it looks like we have quite a few people starting to join us. I didn't know if we already had set questions, but if not, I wanted to make sure that we have time to first address a couple of things. We have our Vice Chancellor, Greg Smith. Thank you so much for joining us today. And I'll just probably turn it over to him shortly in just a few minutes to maybe just give us an update, and then I know questions will start to come up from there. And Nancy Wakeman, thank you for coming back again. And last week, as soon as I closed my book and moved over, I was realizing the bookstore. People had questions about the bookstore. And we still have questions about some of the food on campus and some ideas. And sometimes this is a place of sharing information, but also a place where maybe we can resolve some situations as well. So maybe as we get to some of that, Leslie, thank you for being here. Mental health, we have some questions and issues. I better stop because I'll just keep talking for everybody. Anyone else want to say a quick announcement before we start off with Vice Chancellor Smith? Marciano, anything at all? John?
No, but well, just to let the team know internally, we got the plexiglass. It's here in the office, so we'll be distributing those. We have 20 of them. We'll get those out in short order.
Little things get us so excited like that, John.
Yeah, it's been a long time coming.
Well, thank you. So Vice Chancellor Smith, if you don't mind, I'll ask you to see if you can give us an overview. And then Caesar will start posing questions, and then we'll bring those up too if you happen to miss them.
All right, thank you, Tilly, and thank you for the invitation.
Oh, is that?
Here's Rosen.
Oh.
Here, let's give a minute.
It's just like on television how that happens.
We're on television.
Good one, Nancy.
Every once in a while.
I could talk about the welcome tents, and so outreach will be having welcome tents throughout the campus. This would be the first point of contact for students, new and returning students. So, you know, we would like students to come check in to these welcome tents. There will be a map that will have the location of these welcome tents. This will be coming out soon. But yes, so outreach will be staffing these welcome tents and welcoming our students back on campus. And so they'll be, you know, providing or checking students' vaccination confirmation if they had the vaccination or negative COVID tests. And so we really want all students to be directed to these welcome tents on campus. Let's see.
Will we be looking for maps of the welcome centers at some point? That we look, okay. No worries. And more to come on those, right? That's enough involving. No worries, Vice Chancellor Smith, anytime you're ready.
And Vice Chancellor Smith, if you're ready and connected, and I think your audio, yeah. See, while Vice Chancellor Smith gets his audio up, and we do have a question from the attendees. How will we know whether a student is immunized for COVID or if they have a valid exemption and when their last COVID test was? Will there be some sort of online or physical Go card?
Good question. Actually, I did get quite a few answers that were sent over to us from our health center. Thank you, Leslie, Dottie, whoever all sent those questions over to us. And we did get a list. I'm going to be following up with those. And I'm not sure, Marcion, did you want to follow up with the access or any of that with health centers?
Yeah, I'll follow with them individually, but I mean, folks will have the opportunity, if you're in the student portal, you'll be able to see who has a valid exemption and who has who has the vaccination. So there's two different service indicators in the student portal. In PeopleSoft, so when you're looking at the student, you'll be able to see which one they have. And then we're working out the testing one that hasn't been completely firmed up yet.
So we can see you, Craig, but for some reason, I don't know why.
Can you hear me now?
Yes.
Sorry about that. I don't know what happened with my camera and microphone. But as I was saying and nobody was hearing, thank you so much for the invitation to join. Too much of my introduction to people has happened through email and joining the district in this COVID pandemic. I haven't been able to get out and meet very many people in person. So at least having this opportunity through Zoom is much appreciated. Obviously, the big news right now is the Delta variant and the increase in cases that we're seeing locally, the decision-making that's happening across many employers around the country and in our state about how to continue or to start working in person, but to do so safely. And as I expect everybody's had a chance to read now, Chancellor Cortez's email earlier this week announcing that unvaccinated employees and students will be required to be tested weekly as part of our mitigation strategy. So I think that's probably the best place to start. And I want to explain a little bit about the data that we're looking at and kind of how it's informing decision-making, and watching very closely our county-wide data. Each week, the county updates some key information on Wednesdays about our case rates, and especially among vaccinated and not fully vaccinated, which is much of the conversation that we're hearing right now nationally is around how much of the pandemic is being driven by infections of people who are not yet vaccinated. And so as of last week, for the last 30 days in our county, among the population that's over 12 years old, so those that are eligible to be vaccinated, about 89% of the cases that we had have been among those who are unvaccinated. And that's a significant increase from where we were at the beginning of July, where that was more like 98% of the cases. And so clearly the Delta variant, we are seeing more individuals who are fully vaccinated getting COVID, but there's a lot around behavioral choices that individuals make that are important to go with that. I assume many of you are seeing what I've seen since June 15th as I go to the grocery store or other places out in public. The majority of people I see are not wearing any face coverings. I've seen, as I walk by restaurants, a lot of people gathered in larger groups together. And so engaging in behavior as if the pandemic is virtually over. And we don't have great data about kind of where the infections are happening relative to those individual behavioral choices. And so looking at what the CDC is recommending, what our higher education partners in the UC system, the CSU system, other community colleges in the area are doing, and figuring out, are our protocols going to keep us safe? And I read something from UC San Diego's president that I thought was a helpful analogy of kind of a Swiss cheese approach, as he termed it, where any one measure by itself is not going to be 100% effective. But as you start to layer measure over measure, you increase the likelihood that if somebody who is COVID positive comes into our environment, whether it's a class to get student services, a coworker in an office, with a combination of things all in place at the same time, we have a very low likelihood of spread. And so continuing to have a face covering requirement, regardless of vaccination status, becomes a very important part of that. The work that our facilities team has done to upgrade the ventilation systems in every single building across the district, so that over 90% of any contaminated air particles are being filtered out as the air conditioning recycles air, increasing the amount of outside air that is being brought into that system, so that we don't have just the same air recirculating and aerosolizing the virus within a workspace becomes a very important part of that. Thank you, Dottie. Yeah, exactly. That's a great pictorial representation of what I'm talking about there. Using staggered schedules and work shifts and work locations so that we don't have large numbers of people congregated in smaller areas. Each one of those additional layers adds a degree of protection, and vaccination becoming a really important part of that, because we are seeing that those who are unvaccinated have a much higher likelihood of getting COVID than those who are. And so adding testing to that is another one of those layers that helps us feel confident about working alongside someone without knowing their vaccination status, but knowing that they have been tested recently and they tested negative. Will allow us to continue to track and respond to any changes in the data in our region and within our own work environment. I am meeting with the company that's going to be providing the testing service on site later this afternoon. I would love to be able to tell you exactly how this is going to work, but I can't do that yet. There are parameters around how many people need to be tested and which sites and which days and times that we need to sort out. I hope to have those details, if not by the end of this week, early in next week. And then I'll be able to send out a very detailed email with all of those specifics in there. I'll add to that, in addition to the on-site locations, and I would expect, let me say, that we're going to have most likely 2 days of on-site testing at City College each week. Exactly which 2 days, I don't know, but I fully expect between the students and employees that'll need to be tested, we'll be able to support having 2 full days. And hopefully that'll be enough to where, you know, the overwhelming majority of people that need to be tested will be on site anyways with their regular schedule, even those that have a hybrid work from home and work in person schedule. Anybody could go to any publicly available testing site, Walgreens, CVS, a county site. So you don't just have to use what's available on campus. If it's more convenient for you to go somewhere else, that'll be fine. With that, we'll be working on how we can make this very easy to get that information both submitted and then usable for the people that need to see it. And so I heard, while you couldn't hear me, a question about how will we verify a student's status, their vaccination status, their testing status. I'll have more details on that. We may end up with some very kind of simple tools where you can go into a dashboard and just type in somebody's name and see, yes, they've been cleared. You wouldn't necessarily see any specifics about that clearance, what exactly it is, but you'll know that either they've got a negative test or they've been vaccinated. Whichever it is, this person's cleared to come on site, attend class, attend a counseling appointment, whatever it might be. And that would be real-time information. And so hopefully, if you do get tested off-site, you would be able to just very quickly submit that test result into that system, and then it's going to automatically update, and that's available. So we're working on those details. I'll have that additional specifics out as soon as I possibly can. So that's kind of the major news where we're at right at this moment. So let me stop there and we can address specific questions or topics that people would like to hear about.
Caesar, I wasn't sure if there was still some questions in the old Google Doc from before for Greg. And if not, we'll just kind of wait and see if there's more questions that will show.
I do have a question, Vice Chancellor Smith. So you mentioned that students would be able to upload their, they're already able to upload their vaccination proof or exemption or whatnot, but students would also be able to upload, you know, their negative COVID results to the site or whatnot. So is that something, obviously, in order to come every week, they'd have to upload every week? Is that correct? Is there, will there, and I'm sure you're still working all these things out on the, you know, when we check that, it'll say, you know, it'll show that the COVID negative test is current, or what's the parameters around, you know, like how long ago do they have to, you know, have had it, you know, like if they're coming to a class that's on a Wednesday or a Thursday, like do they have to upload it by a certain time, or does it have to be a certain day that it, you know, does that make sense? I'm not sure if I'm making myself super clear, but I'm sure some others have that question also.
Yeah, I think I understand what you're asking there. So Educational Services is working on this, and the kind of draft form right now that we're in is that we would send out notifications every single week reminding the students that they have this requirement. They would have to upload a negative test by Sunday to be eligible for the week that's upcoming. And so that negative test would be from that week before that Sunday they did it. If they did it on site, they won't have to do anything. We'll definitely have that information. If they do it off site, how that information gets in is the piece that we need to work out. But they'll get that reminder every Sunday. And so come Sunday, if they haven't uploaded something, they'll be notified. So will the instructor of the course that they're enrolled in, that they're not cleared this week. If it's a Wednesday class and on Tuesday they upload that information, then they'll go in real time and update their status. Okay, you're good to go to your class Wednesday morning. The notification would go to the instructor. That's kind of the way that's being planned to happen. I don't see that deviating too much. Just some of the finer details in that process might need to evolve a little bit, but the general framework, I think, is how that's going to work.
Can I ask a follow-up question about students who are not yet students on our campus? So for visitors or prospective students who are coming to campus for, help with completing an application or whatnot, is that what will, they won't necessarily, I don't know if they would have access to a portal to upload, but is there a process or plan in being put together for what that might look like for visitors to campus or not yet students to campus?
Yeah, and Marciano might be able to fill in some of the specific details for City, but I'll share, as I've met with Vice Chancellor Topham and all the vice presidents of student services, the process that I'm hearing is that we're going to set up welcome stations or something along those lines outdoors at each of the colleges. General public that want to come up, that's where the interaction would happen. So it's outside. We have the face covering requirement. These are not going to be, hour-long conversations, fairly limited exposure. So we won't know that person's status as they come up, but doing it in an environment that should be very, very safe for that interaction. Now, at the point that they want to schedule an appointment for some kind of service to have counseling, to sit down and do a one-on-one appointment to go through the financial aid enrollment process or whatever it is, DSPS services, EOPS services, that's where we would get them into the system and verify vaccination status or the testing. And somebody who's not enrolled as a student who comes into our testing site on campus, we would be able to get that information in. So we would be able to verify them the same way we would a student who's tested. If they tested somewhere else and they're not part of that system yet, then I think what will likely happen is they would show us the negative test result. And so that, I think, for most people comes via an email, so they could show that on their phone if they have that capability, or they printed out a copy of that paper, but a way of verifying that. Each college is going to be able to kind of tailor that operation to fit the way that they're going to be doing things. So it may not be exactly the same at City, Miramar, Mesa, and continuing education, but within that general framework of a way of engaging people in a safe way for general inquiries, and then guiding them through to individual appointments where we then add that layer of verification of vaccination or negative test.
I don't know if it's a follow-up or just the same question again. So just walk me through one more time, Greg, that I'm a faculty member running a class. I have a class that starts on the 23rd of August at 9 o'clock in the morning. What do I need to do do I just open the door and let my class in? What are my responsibilities?
So I can answer to the best of my knowledge on this, but there are going to be gaps because Vice Chancellor Topham's been working on this part more than I have. But my understanding is that they're going to get, I would assume probably on the 22nd, the 21st, I mean, the day of the week's going to matter, on the business day prior to that class. Here's a list of all of the students that have been cleared. we will have dropped everybody who has not submitted their vaccination status or hasn't been approved for like a medical exemption. If they've been approved for an exemption, they'll already have been notified, you have to be tested in the week before you show up to class on the 23rd. And so that part of that notification to the faculty member will be everybody who's not on this list or maybe separately identified, they are not eligible to be in class. And they've been instructed that they're not eligible to be in class. So if they try to show up, you know, there is going to be an interaction there of saying, I'm sorry, but you haven't been cleared. You need to follow up with, you know, however that routes through educational services to get their test result in or their vaccination status verified.
Jeannie and Genevieve and Aaron, were those the questions we heard on Wednesday with the deans? Is it satisfy with where you're at? Jeannie, go ahead.
Oh, no, yeah, those were the questions because this news was kind of just breaking now, and VC Smith, Tilly did share that you were having meetings coming up and would be joining us, and thank you for being here. Thanks for the information. We understand this changes every 5 minutes, but we appreciate the support. But yeah, those are, I think maybe some people listening, we have some flex professional development for faculty coming up, and this will also speak to the need to engage in a non-confrontational way, right? We don't want this to be a sore spot or to cause friction for anyone. We want it to be effective and for everyone to realize that safety is the goal here, and we're not trying to bar access for anyone, but all good progressive steps, necessary steps, needed steps, I guess I should say. But I do, this puts a load on our faculty colleagues.
I've been kind of cycling back through some of the questions coming into the chat, which if you want now, I could go through and start addressing some of those. Okay.
Please do.
Yeah, so the question about what the COVID testing entails. So we're working with a company called Biocept. They're based here in San Diego, and they do what's called PCR testing. So this is going to be a nasal swab. There will not be any blood draws as part of this. It'll just be a nasal swab. For those of you that haven't had it, it is a little bit invasive. It's a deep nasal swab. So if you're a little congested, you will walk out with cleared sinuses a little. I did not find it to be painful at all. It is a little bit uncomfortable, but it's literally over in a second, maybe 2 seconds. They can do the entire testing process in 3 minutes for you. So showing up, being confirmed that you're there, who you are, doing the swab, and then getting you out on your way will be very quick. Scrolling down. Yeah, so the question is, campus facilitated testing would automatically populate into our system? Yes, I have every expectation that that's how that's going to work. I don't have any reason to think that this is going to have to be a manual process in any way. Somebody who goes outside of our system, yes, there will be an interaction from them with the system to upload the test result from a third party. What I heard in our initial meeting with Biocept is I think that they have an agreement with CVS. If somebody gets tested there, they can import their information in. I need to verify that that's true, but that's the only one that they mentioned that might be like that. So if somebody goes to any other testing site, they're going to have to submit that record in. But from what I've heard initially, once they do, we won't have to do anything else. They put that in there. It's loaded into the system. We can go in and see and verify that the same as we would if they came to our site. It's just if they don't take that step, then we won't see it. And so we'll have to treat them as if they're not cleared. Who will be running the campus testing? Biocept provides the medical staff to do that. They will not have access to our system at all. That'll be managed on the back end. So we provide data to them. So all the students who have been cleared for an in-person class that are not vaccinated, that have a medical exemption, for example, we'll be providing that information to them. That's how we connected back to Campus Solutions. Somebody who is a prospective student who comes in, for a counseling appointment, at the point that we add them into Campus Solutions, then we can link that up. So we can update this in real time with BioSep. So as people get added or as people get removed over the course of the semester, we'll be able to continuously add and remove people. Will the testing be outdoors? BioSep's requested, if it's possible, to identify indoor locations. Their staff are going to be wearing PPE. Obviously, they're interacting with somebody who might be COVID positive, who might even be symptomatic at that point. So they need a layer of protection. With that, obviously, it can get warm wearing that equipment. So if we can provide indoor space, we will. But obviously, this would be larger space where physical distancing would absolutely be maintained, and there is plenty of air circulation and ventilation. If that's not possible, then it will be set up outdoors, but it'll be covered. We'll put up tents or some types of sun protection and covered space if we should happen to get some rain. And hopefully the weather cools up here shortly, and that wouldn't be as problematic for their employees. The privacy, how do we protect privacy? So part of our agreement includes full compliance with HIPAA and FERPA protections as they apply. And so there's only the staff that need to have access to information on their side will have it, the same on our side. So someone, as I mentioned earlier, you might be able to see that somebody has been cleared, but you might not be able to see what that clearance was exactly. So you're not seeing any specific information about a person necessarily. The turnaround time on the testing, right now they've told us that they're able to do this in 24 hours with virtually everyone, very, very few exceptions. Of course, a large number of employers around the state are going to be requiring testing for unvaccinated employees, either just now starting or starting very soon. So demand is certainly going to go up. Their contractual obligation is to turn it around within 48 hours. So it should not be longer than 2 days for anyone, but the majority of the time it sounds like either same day or early in the following day.
Greg, and thank you, everybody. I've been having some technical difficulties on campus with my camera. It looks like I'm finally figured it out. I had to update the Zoom. Greg, can we're getting a lot of questions, particularly last week and the week before, about vaccination status. Can you talk about HIPAA and whether or not that is a question that people should be inquiring about, and anything related to if someone found themselves wanting to inquire about someone's vaccination status other than themselves?
Yeah, so for us, it's not a HIPAA concern to ask this information. We're doing it specifically in the context of employment. We're doing it specifically in the context of a public health pandemic with emergency orders and a legitimate need to know this information for health and safety. We're not medical professionals asking for this information to be used in the determination of somebody's medical treatment or that kind of context at all. As far as other people beyond, and when I say us there, meaning specifically HR asking for and tracking this information. If, for example, Ricky, you and I are walking across campus and I say, hey, Ricky, by the way, have you been vaccinated? And you say, you know what, Greg, I don't want to talk to you about that. Taking my title and roll out of this, I need to respect your answer. The same way as I asked you, hey, Ricky, how you feeling today? Do you have a cold? You don't have to disclose any personal health information to me as your coworker. If you want to talk about that, you are certainly free to have that conversation, but you can't be coerced into it. And nobody should be treating other people in a negative way based on what they are or are not willing to talk about their personal status. If HR has said they're cleared to be on site working, they're cleared to be on site taking a class, they're cleared to be on site in appointment, you need to trust that and let that be enough. And I know that that's difficult in a time where we're thinking about our personal safety and the idea of interacting with somebody we don't know. Is there a level of risk? And that's a difficult thing I'm asking you for. But I need you to join me in having that level of trust that the system we're putting in place, if we tell you that they're cleared, that they have submitted the right information, it's been verified, and you can go into that interaction confidently with the measures that we've put in place. Continue to wear the face covering. Don't congregate in small groups within 6 feet of each other unnecessarily or for extended periods of time. Shift activities to larger spaces where we do need to have larger groups. Using all of those measures that we talked about, each one we layer on provides another layer of protection, and cumulatively, all of those, I think, will keep us very safe.
I think there was maybe 1 or 2 more questions, but if we can also jump really quickly to ask about the bookstore and how often is the bookstore available and open?
So. Okay, I am now. Hi, everybody. Happy Thursday. First, I want to say, just before I even talk about the bookstores, I just want to let everybody know there's a lot of folks on this call. We haven't been able to get the news out to everyone. Dee Dee Porter retired on Tuesday, August 10th. And it was confidential, and she just didn't want anybody to know. And after 25 years of contract and another 10 of hourly, she is going to focus on her daughter and some other things that she has planned. So I just wanted to share that first. And we thank her for everything she's done over all those years. The bookstore is going to continue to do what they've been doing every day since March 23rd, 2020, which is filling web orders, providing materials for students, whether they're books or school supplies or art kits or whatever it is. They're going to continue to do that. And the difference this semester will be, number one, hiring anybody is a challenge, just so you know. If you haven't heard, restaurants are not the only people that are having trouble hiring. So everybody's having trouble hiring. So we will have enough staff to be able to fill our web orders, and we will continue to, upon request, provide the materials using our buyback window, our buyback windows. We have 2 buyback windows on the south side of the store. And as this grows, Sol Madrid is helping out as our acting supervisor, and he has experience from ECC. He's worked at Miramar, and he has spent the last year since COVID helping at Mesa. So we will be able to distribute orders that folks have placed their orders online. We'll be able to distribute them. They just have to set up a time when they want to come in and pick them up. We've been working with our students for the last year and a half to pick up maybe oversized items, special requests. And the big difference this fall will be when we get to the end of Pell and folks need to do returns and things like that, as we're down to the wire, that time just before Labor Day, before ad drop ends, we're going to be able to do those returns at the buyback windows, so folks can get those returns into their accounts for Pell. So when they do receive their Pell checks about 2 weeks after that, that those checks will be include all of the transactions. For the last couple of semesters, we've made sure that we took care of those students. We have sent them checks. We have they've made arrangements to pick up the money, but we will be publishing hours for those last few days before the end of the period, which is just those few days before Labor Day weekend, to make sure that they can get everything they need and make sure their accounts are up to date. Anything after that, certainly we know there's going to be things in the pipeline. We will continue to do. People can still pick up the money. They can still have a check mailed. Some students are obviously all over the world right now, and we've been mailing checks to places that I've never been heard of. So it's been an interesting time. So we will be there. We are there. We're going to be working our official hours that are on our recording is we say we're there 8 to 4 Monday through Thursday and 8 to 12 on Friday. We obviously during key time as we're getting hundreds of orders in and we're filling orders, we're going to be there later every evening. We are not publishing that for folks because but if there's an extenuating circumstance, if somebody needs something that they can't get there, if we're going to be there, we're going to make it happen. And we will, we're going to be there probably the Saturday before classes start will be the first Saturday of the semester. And we will continue, which we've always done. When we've done that the last four rushes while we've been closed, we've just been doing it. And so we're not going to open the doors of the store. Number one, it probably wouldn't be safe. It is not a big space. We have plexiglass up, ready to go. So when we do open and we'll be ready, but we will, all a student has to do is ask and give us a time, and we will do everything humanly possible to make that happen. And I know Sol is probably watching this cringing, but because I overcommit, but that's what we're going to do. And it's going to be crazy. And if that means we move a table out in front of the door, we may do that just to make it easier for people to have space and do what they need to do.
Thank you, Nancy. And I think you kind of addressed, if there's special requests for pickups that was in there, I think you've already addressed that. Questions about the bookstore, I'll make sure you get that information. And then how much are we still missing of book adoptions and stuff?
I didn't run it yesterday when I was on campus, but we're going to get that number to you, if not today, tomorrow. I know Bruce was pulling out his hair when I was there yesterday with a few things, so I didn't even want to bring up that subject.
So so now with the news of Dee Dee, I will add. Can I add Saul to the instructional cabinet?
Absolutely.
Okay.
Absolutely.
Thank you. Thank you, Nancy. That's been wonderful. I think there's some more questions that Vice Chancellor Smith and our president, maybe Dottie might weigh in on. Thank you, Nancy.
Yeah, I'll go first, Tilly. So there's a question specifically about the type of testing that'll be conducted, and that deep nasal swab that I described is known as nasopharyngeal testing. There will be an alternative for those who can't do that or find it very uncomfortable, called an oral pharyngeal testing, where basically they swab your tonsil area. So it's a little bit invasive through the mouth, but not as perhaps uncomfortable, or for those that can't do the nasal. So there will be an alternative option for someone that can't do that. There was also a very important question, I think, about the decision right now to only test people that are unvaccinated, and why not also test all employees who are vaccinated. I think the first answer to that is a bit data driven. As I said at the top of this, right now, about 90% of the cases happening in San Diego County are among our unvaccinated population. And so that kind of strongly suggests that the biggest risk is happening there. But this is an evolving situation. And if that continues to change, then the decision may have to change with it. It is by no means meant to call out or put burdens on somebody who is not vaccinated for whatever reason, different than anybody else. But it's responding to where infection rates are actually happening, and tailoring our response to that. But this is a dynamic situation, and if a change needs to happen, that may need to happen at some point, and certainly we'll be responsive to that.
President Shabazz, did you want to add on to that?
Well, really great captured everything, and that this is absolutely evolving. And I can assure everyone we are having those discussions in addition to really being in a great position, having a vice president of instruction who's a nurse, having Dottie, who is constantly in tune with the CDC and the county and other updates. So we are actively monitoring this daily. I sit on the board for Charlotte Hospital. I get reports every day about the contraction rates and the hospitalization rates in the county. COVID is real, the Delta variant is real, but in the grand scope of regions to be concerned, San Diego proper and to some degree county, notwithstanding Chula Vista, South Bay, if you look at the areas where this is a much larger concern, not that it isn't a concern, it's absolutely a concern here, but if you look at the areas where it is absolutely spreading, San Diego in the grand scheme of the country and the world has gone through this relatively in a better position than a lot of other places. Now, with that said, we get reports. Greg does a great job, he and his team, on the number of employees, the number of students, whether they're coming to campus or whether they're not. We have over a year of data using programs like exercise science. We have Aaron here using D. Armstrong and our nurses and other instructional programs, student support programs that have had to deal with these realities while on campus. And we believe that we are very well positioned to continue to offer a certain level of services in person, while at the same time preparing to pivot if in fact the Delta variant continues to increase.
If I may, I just wanted to state, as a faculty member that's been in the district for over 20 years, that the leaders of this district are concerned about the health and the welfare and the lives of the students and people that work in this district. They are not concerned about the optics. And I have great assurance that they are doing what they are doing based on the science, based on data. The vaccine is a miracle that we have. We have a solution to this virus. The vaccine is not free, despite that we are all getting it free, nor are very high-tech testing kits, whether they be oropharyngeal or nasal PCR, those are not free. There is a limit to what any organization or system can do with regard to screening. We do not screen all men for breast cancer because it wouldn't be financially or medically indicated. And therefore, we know that this disease with this Delta variant is being propagated more and incubated more in unvaccinated individuals. Therefore, from a medical and financial perspective, it does not warrant testing at this time vaccinated individuals. So I would like to continually acknowledge that both unvaccinated and vaccinated people have their rights, but in the same way as this country has had to make public health decisions about where one can smoke or about our ability to use or not use a seatbelt, I would like to make the case for care and concern and understanding for both rights of individuals. And I did almost said sides, but I'm gonna not say that. And I thank you all for letting me share.
Thank you, Dottie.
Greg, Jennifer raises a great question in the chat about the threshold in the district. Maybe you can go first in terms of county, state, federal, and then I'll follow up.
Yeah, so the question for those who can't see it, that Jennifer asked is kind of what is the threshold where the district would make changes in what we're doing? The local infection rate is the most important one. Definitely watching what's happening in other parts of the country as a way of anticipating what may happen locally. So, seeing the case rates in Florida, for example, other parts of the South that are much, much higher right now, but then combining that with what's the rate of vaccination there and how does that inform where we might be at 2 weeks from now, a month from now. If we see the rate of infection among the vaccinated population, start to account for more than 20% of our local cases, I think that we're definitely going to be having a really hard conversation in cabinet about, do we need a more frequent or a more expansive testing program? And at what point then do we need to rethink whether or not it's safe to be in person right now? Certainly. So the hope obviously is that we don't have to reach that point. But the kinds of things I'm looking at, so right now, or I should say as of Wednesday across the county, about 2,075,000 residents had received at least one dose of a vaccine, according to our county public health. Over the last 30 days, there have been just over 1,800 cases among that population of 2 million. That's a really low rate right now. And so that suggests that it's relatively safe. And that's what I was saying earlier. It would be great if we could know things about kind of the conditions in which the transmission happened. You know, were those 1,800 engaged in more risky behavior? Were they, you know, at a party or a restaurant or a bar or a club, not wearing face coverings, closely packed in together for an extended period, versus our environment, which is not going to be like that at all, right? We see that number start to increase fivefold, tenfold, where it's 18,000 vaccinated residents across the county over the course of a month among that population of 2 million. That's where it starts to become a lot more concerning. And then, of course, what's happening actually within our employees and students. And I posted in the chat where everybody can see the weekly update that we're making on our website, the cases within our population, and some data around the national, state, and local experience. So you can go see that every single week. That's the kind of data that we're looking at and talking about in cabinet, and it's just driving decision making.
Yeah, and I would echo that these conversations, folks, just like I'm probably sure it is in each of your offices, are happening minute by minute, hour by hour, day by day. If you think of this matter as a bell curve, what I believe is going to happen, looking at the past and being a researcher myself, Labor Day is going to be a big point. If people's behaviors lax during Labor Day, then we're likely to see a spike, which would most likely occur about 2 weeks after Labor Day. Once we get through Labor Day, then we'll have to get through Thanksgiving. Once we get through Thanksgiving, we'll have to get through Christmas break. And so you're going to have these periods, depending largely on people's behaviors, that'll dictate how we respond. I've been so proud and impressed with the way everyone has pivoted and transitioned when we needed to, that we've learned a lot about this process, which is why as grades communications have gone out, we're not necessarily saying everyone is coming back for 5 days a week, 8 hours a day. People will have an opportunity when and where possible to work on campus, to work remotely. That is going to be largely dependent upon the size of the office, the number of people, and imagine this, student demand. You know, we really have to continue to be here for our students, and many of them don't have access to the internet. Many of them don't have access to a computer. They've had to come to campus to even get those things. So kudos to the library staff. Many of the people who are quote unquote coming back, the fact of the matter is they never left campus. They're here a day a week, they're here 2 days a week, they're here 3 days a week. And then the other times they're able to work from home. And so what this is doing is that those individuals who haven't necessarily been on campus, we're saying we still need you to come back some number of days, some hours, dependent largely on your supervisor, your manager, and your work conditions. So we'll continue to communicate. Everyone's looking for just a universal answer, which I would equate as equality. And we say as a campus that we're committed to social justice, and equity. And what that means for me is that we're going to have conversations with people who have very real things going on at work and very real things going on in their personal lives. And when and where possible, do our very best to make accommodations. When and where we can't make those accommodations, then we're going to work with you as to why we can't make those accommodations. But we've learned a lot through this process. And again, I'm so proud of this college and what we do for our students in our community. And I just fully expect us to continue to do that, whether it be hybrid, remote, on-site. A host of things are going to continue to happen as they have been.
Thank you all. I hope this has been informative. It has for me, and every day, every minute changes quite a bit. We had also brought on a couple other people as well. Thank you, Aaron Deddy, for being here. He's been living a lot of the testing with the athletics. So if people have questions and things like that, you know, Aaron's been living it for a little bit of time. And you have it worked out pretty well, right, Aaron?
We've been doing a great job, and a lot of us do the partnership with Biocept. And we have an amazing medical staff, Jamie Jenkins, and working with Dottie and Dee and you, Tilly. We are doing a great job here. And we're going to keep on doing a great job keeping our students very safe. It is always on the side of caution, and we're doing very well over here. Thank you.
Thanks, Aaron. And I think we're already coming up to the end of the hour. I can't express enough of just thank you. And Greg, it's always just so comforting to have you in the meeting with us. And I know that if you don't have an answer, you're going to go help us find it. I wish I could keep you in every Zoom with me all day long. And I know there's people here with me that feel the same way. So appreciate it. And maybe maybe another month, we'll have you come back. And same thing, Nancy, if that just lets you know. And I know you're working out different situations for the food on the campus, and people get anxious where it's going to be and all that type of stuff. Just give us a minute. We'll get to it, right?
Yeah, and we will be there. We're open in the MS building. And I think it's 7:30 to 2. I think that's from memory, Monday through Thursday, because that's when the building is open. And we'll be there on the 23rd.
So thank you. And I think Leslie had an announcement.
I do. Thank you. Just really quickly as we wrap up, I wanted to remind everybody to check their emails. There is a flex. There are 2 flexes next week on Tuesday morning, both designed to help faculty and staff kind of manage the reentry, one on the psychological side, managing the anxiety and kind of the ever-changing instabilities of what to expect. And the other is the Campus Ready Toolkit that Bree mentioned last week that really is going to have some flow charts and some decision-making processes and some suggested language to use with students and with other faculty or staff, you know, if there's concerns about masks or testing or those kinds of things, really trying to create support for the most positive environment we can create with all of this kind of anxiety and tension that we're going through. So please check your emails Tuesday, 9 a.m. and 10:30 a.m. We would love it if you guys join us.
And if I could just publicly thank Leslie and Dottie, you know, our health center, the professionals over there are the best in the country. And I believe we're going to be featuring Leslie, or we'd like to feature Leslie and her team, the work that they're doing embedded in Emoja Puente and some of our science courses. And Leslie Marciano and I've had some conversations about how do we continue to support with minority serving institution funds. The anxiety, that's a key word, right? Anxiety and trauma, folks, we're all experiencing this. We're in a pandemic. And so, you know, if you see your students going through something, please refer them to our mental health services, to our health center. We continue to help students and employees to some degree with these things. And we're going to continue to put money into mental health. And so thank you, Leslie. Thank you, Dottie, for what you all do for our students on our campus.
Tilly, there was one question about for faculty, if they are, we have unvaccinated students in the class that have exemptions. how will they know that that student has cleared testing for that week?
If I heard the vice chancellor correctly, and maybe I missed that one, but they won't be on the roster if they haven't been cleared. Is that correct?
If they don't have an approved exemption, they're going to be dropped. If they have an approved exemption, then the faculty member will be notified of anybody who has not completed their testing requirement that is not then eligible to be in class for that week until they do. And so that'll be happening every single week. Educational Services is managing that process. I can't say exactly how the notification is going to come and who it's going to come from, but that's what they're putting together, a way to notify each faculty member. Here's everybody that's cleared for this week for your class.
So that says we need a follow-up with Vice Chancellor Topham to come and visit. Thank you. And, next week, Ricky, is our convocation. And normally Campus Ready would happen right after that. So I'm not sure if that'd be too much on that day. Maybe we'll move that to like a Friday or something, and I'll see what we can do.
You all deserve a break. Everyone involved in this has done an amazing job trying to create a platform where people can ask any question. We've answered every question that has come through. There is no question that we're not willing to answer. Folks, we don't have this figured out. There are some things we know, and there are a lot of things we don't know. We are getting through this collaboratively together. So please bring your questions. I think we do need to take a week off next week as we have convocation on the 19th. We'll have a lot of updates there. Then we'll resume the week after convocation. Special thanks to Luke and Caesar, Tilly, Genevieve, everyone involved with creating this platform. Jeannie, great presentation today. Thank you all, Marciano. This is a team, City Love. We love each other. We love our students. We love what we do. And on that note, folks, go get some lunch. Enjoy the rest of your day, everyone.
Thank you, everyone.